Welcome to Lunch with Your Pediatrician. Hi, I'm Dr. Olutoyin Malomo. Um, Today we'll be talking a little bit about breastfeeding and why, as your pediatric providers, we really feel that you should nurse or breastfeed your child or your baby. Now let's start with the definition of breastfeeding. What is it? So breastfeeding is the art of feeding a baby or young child with milk from the human breast. And as you know, breast milk is superior and the most ideal form of nutrition for your baby or young child. Now, breastfeeding is said to be a natural process, but like any good thing, all right, it takes some work. Most mothers and babies would have to practice, right, the art of nursing before they get comfortable with it. Now, the American Academy of Pediatrics now recommends, exclusive breastfeeding. That is, you give your baby breast milk and only breast milk, nothing else, for the first 6 months of life. And then when your baby is 6 months old, you introduce complementary foods like cereals, fruits, vegetables, and meats. But then you keep nursing or you keep breastfeeding your baby till your baby gets to 1 year old at least. And you can even go on for longer as desired by you, the mother or baby. Now, the World Health Organization, recommends that you actually nurse your baby till 2 years old. Now, studies have shown that breastfeeding rates are going up in the United States, which is good news, and that about 81% of moms will initiate breastfeeding, and that at 6 months old, the mothers are still 50% of mothers are nursing. But then that number drops down to about 25.5% of exclusive nursing, and then way down to about 30% at 12 months of age. Now, the question is, why do moms start breastfeeding, right, and then don't breastfeed after some months? Some of the factors that are thought to cause this are things like a lack of support from family members, we as health providers not encouraging you to nurse, and also work factors like difficulty pumping or nursing when you go back to work. Now, this falls short of the Healthy People's Goal, right? That's the 2020 goals, where actually it's desired that you as mom would exclusively nurse your baby till 6 months of age, all right? So we're looking at least a goal of about 25.5% of exclusive nursing at 6 months old. Now, I guess thinking about it as a mother, if you know why breastfeeding is good, right, or why it's beneficial, then you are more likely to opt for this form of nutrition for your baby. So let's talk about the benefits of breastfeeding, right? There are medical and psychological benefits, right, for you as a mother and your baby, right, to nurse or to breastfeed your child. So for you as a mother, what is in it for you, right? There are very, very good benefits. So one of them is weight loss. So as a woman, right, trying to have a baby, we do put on a little bit of weight during pregnancy. Breastfeeding actually causes some degree of weight loss because you have to burn quite a few calories trying to nurse your baby. The other thing to notice that, your uterus or your womb returns back to its pre-pregnancy size or shrinks quicker when you nurse your baby, and therefore this leads to fewer postpartum bleeding days. The other thing too is that when you nurse your baby, the chance of breast and ovarian cancer is way decreased, okay? When you nurse, there's a lower chance of postnatal depression, and there's also a slower return to fertility, right, after having your baby. You have stronger bones, which leads to fewer fractures in old age. You also have a lower chance of cardiovascular disease, so lower chance of high blood pressure, lower chance of heart attacks, lower chance of strokes when you nurse. Also, when you think about it, right, breastfeeding is actually cheaper and more cost effective. So you should go look at the price of formula out there, right, in the shops and the market there. Formula is pretty expensive. Now think about it, when you do breastfeed, right, all you have to do is eat a healthy nutrition. So you don't have to pay all that money, right, for formula. So for you, that's cost effective, right? Cheaper. It's also convenient, right? So if you think about it, breast milk is ready in your breasts. It's at your body's temperature, right? Nice and warm, right? All you have to do, these days you have to have your baby sleep in your room, right, for the first 6 months to 1 year to prevent the sudden infant death syndrome. So your baby is in the bassinet in your room at night. All you have to do is just pick up your baby, right? The breast milk is ready there, right? You just connect your baby to the breast. You have your baby nurse, you burp, and you put the baby back down on its back in the bassinet. So you don't have to start running around to sterilize bottles, prepare formula, stuff like that. There's all that not needed. You just take your baby, you nurse, and you place your baby down. So that's another very good thing. Now for the baby mom diet, right? There's that degree of bonding which you don't quite find when you feed the baby formula from the bottle. So you have your baby connected to your breast. There's that time alone with your baby, and there's great bonding between you and your infant, right? So the baby learns to trust you. You develop a very close relationship with your baby, right? So that's a very good thing. So these are benefits for the mom, baby mom. If you think about it, if you do not breastfeed your baby, though, then you're not going to get all those nice benefits, right, for you as a mom. And I don't know how close in terms of bonding you'll be, right, when you don't breastfeed your baby. Now, the other thing to talk about benefits for the baby itself, or for the young child. Now, you know that breast milk contains all the nutrients that your baby needs for good growth and development. It has lots of calories. It has way over 400 nutrition ingredients which are not present in formula. The breast milk contains immune factors. So antibodies, enzymes, immune factors that help your baby fight infection. So the baby would have a lower chance of ear infections, less GI infections like diarrhea, less wheezing or asthma, less risk of obesity in the older age. There's a lower chance of certain cancers. There's less severe eczema. So not that they can get an eczema, but it's not going to be as severe, or it's delayed, all right, when you breastfeed. There's a lower chance of the sudden infant death syndrome, all right? There's lower chance of some viral and bacterial infections. And they're also thought to be smarter. Some studies have shown that when you nurse your baby, they actually have a higher IQ, they're smarter babies. So if you think about all this though, so a baby who is healthier, right, because you're getting all this beautiful stuff in breast milk, you don't have to come and see us in the office that often, right? So you have less frequent sick visits to the office here. You have to take less time off work. So for you as a parent, right, it's more convenient, right? You're not having to run around that often because your baby is healthy and your baby is well. Wow, these are fantastic benefits in my book from breast milk. Also, breast milk is easier to digest, right? Breast milk is from the human. Human milk is for the human. Formula is processed cow's milk, not quite designed for human beings, and therefore you're more likely to be colicky, more likely to have problems with formula compared to breast milk. Breast milk is always available, right? It's right there in your breast as a mother, like I mentioned before, and does not require preparation. It's there, it's ready, it's available for you. All right, now you remember, the longer you nurse your baby, the greater the benefits, and the longer those benefits will last. Now, come to the practical terms, babies can nurse within 1 hour of birth. All right, so provided you as the mother, you're well, your baby is alert and well, please, within 1 hour of birth, you connect your baby to your breast. Now, skin-to-skin care makes nursing more successful. By that I mean that the baby is dressed down to the diaper only, connected to your bare chest. You put the baby to the breast, latches on, and you go for it, you nurse your baby. Now, most newborns can nurse, like I said, within 1 hour of birth, and you tend to want to nurse on demand. You look for your baby's hunger cues, and you nurse as soon as your baby is looking for it. But on the average, newborns would nurse anywhere between 1.5 or 1.5 and 3 hours, and each feeding session would last somewhere between 20 to 45 minutes between both breasts per session. But then the bigger babies then feed for shorter periods because they become more efficient at extracting breast milk. Now, there are very few contraindications to nursing or breastfeeding. Now, what are some of these contraindications? So reasons why you cannot nurse your baby. So one of them will be things like a baby born with a certain genetic rare metabolic condition called galactosemia, and that's pretty rare, but that will be a contraindication to nursing. Another thing would be mom with severe illnesses or severe mental illness. mom with certain infections like, HIV infections here in the United States. It's not the case in the underdeveloped world, but here in the United States, yeah, HIV in the mom would be a contraindication to nursing the baby, and active TB or active tuberculosis. Now, moms who are taking certain anti-cancer drugs or chemotherapeutic agents, moms receiving active radiotherapy at that point in time, and moms who are taking certain illegal substances, a substance of abuse, that would also be a contraindication in some situations, not every single substance, but in some of them. Now, coming back to the technique of breastfeeding, right? Some moms have a problem with that feel of the baby sucking directly from the breast. Now, if you've got a problem with that, where you don't like that sensation, then you can totally express the breast milk. You can pump. So you can pump manually, right? Or you can use a breast pump. There are various kinds of breast pumps. There's the single-sided breast pump. You have the double-sided breast pump. Those are thought to be a little more efficient. And like I said, you can manually extract the breast milk. Now, I guess the advantage of pumping the milk is that daddy, right, baby's dad or your husband can help you out with feeding. Other family members too can help you out with the pumped breast milk while you get some sleep and you get some much needed rest. I guess in the first few months you can feed the baby pumped or express breast milk via a syringe, or you can be taught how to cup feed the baby, right? So that's the way in which you can do it. Also, breast milk can be frozen in the freezer, right? So you can keep it in the deep freezer for about 6 months, where you can use this stored frozen breast milk months down the line when you return back to work. You can put pumped breast milk or express breast milk in the fridge, and you can use it within 5 days. All right. Now, what are some of the problems that you may encounter with breastfeeding? So some of those problems would include poor latch or poor suck. All right. So the baby is not latching on properly, or you also have some babies who are very sleepy at the breast. For you as the mother, you may experience sore nipples, or you can find that one or both breasts are engorged. Sometimes your nipples can get infected, or you can actually get the breast itself infected, what you call acute mastitis. Now, that should not, these little problems, a lot of them are teething problems, and they do resolve with time when you get the right kind of support that you need. So right in the hospital, right where you have the baby, many of the hospitals here in Rochester are baby-friendly hospitals. That is, they totally support breastfeeding. So right from when the baby is born, you have doctors in the hospital there, you have the midwives, you have the nurses, and you also have lactation consultants who, can actually help you out with teaching you how to latch the baby onto your breast, addressing these little problems that you may come across when you start nursing the baby. Here in the pediatric office, we're here for you as your pediatric providers. You come in here, you see us, you talk to us about whatever issues are going on with the breastfeeding. We can help you out, and we can also direct you to where you can get help or support in the community with these little problems that you may experience to start with. There are breastfeeding organizations like the La Leche International Organization, and there are many other breastfeeding peer support groups out there, and we can point you to all these places where you can get support. Even for those who are enrolled on the WAKE program too, you also have support from that particular organization as well. All right, so remember, I think the long and short of what I'm saying today as one of your pediatric providers is that we very highly recommend breastfeeding, because it's honestly the number one nutrition that you would choose for your baby. It's very superior to formula feeding. Now, even if you can't entirely breastfeed for as long as, we'll say 6 months exclusively to at least a year old, remember that some breastfeeding is better, or some breast milk is better than no breast milk. All right, so we're here for you as your pediatric providers at English Road Pediatrics. Like I said, we'll highly support that. And remember, nothing ventured, nothing gained. So we hope that as your pediatric providers, you will choose breastfeeding, or you will highly consider it as a method of feeding your baby. All right, so take care, have a good day, and we'll see you again soon. Take care.